FirstHealth of the Carolinas, a private, not-for-profit healthcare network, is headquartered in Pinehurst, North Carolina. The laboratory services of FirstHealth provide laboratory testing for the 4 hospitals, convenient care, and physician practices in the 6 counties they serve.
Hello, I'm Chuck Schirmer. I'm a pathologist working for FirstHealth. I'm the laboratory director of 4 of our 7 facilities. I'm here today to talk a little bit about what laboratory medicine is and who's involved, and how we interact with the clinicians and caregivers in our system. We have 7 different facilities, including oncology laboratories and smaller hospitals in Hoke and Richmond and Montgomery. Laboratory medicine is a part of medicine that most patients and most doctors don't think of, at least as far as the people that are involved. But actually we have a whole group of people that helps provide data that will let a clinician determine the type and extent of disease and response to treatments. We do everything from collect specimens, we transport specimens, we process specimens, and then we analyze specimens. And after that, we produce data and information. The specimens that we look at can be anything from blood, saliva, urine, tissues, placentas, biopsies from lungs, you name it. We can look at it. That's all done in our facilities here, and a few things that we don't offer. We have a special team that packs things up and sends them to reference laboratories all over the country.
The laboratories of FirstHealth are an integral part of the health system's growth. Performing over 3 million tests annually, the lab offers a broad menu of laboratory testing and services. Patient collection centers are located throughout the service region for convenient patient access. FirstHealth's laboratory is accredited by the College of American Pathologists.
Our job is to provide information. We're like the caddies of golfers. We don't hit the ball, but we give the guys that do hit the ball the information that they need so they can make the right shot. We provide quantitative information, we provide qualitative information. We grow germs and tell what antibiotics will be useful and which ones won't be useful to treat patients with infections. All these people have specialized training. Just like a nurse would have training to be a nurse, these people have training to work in a laboratory.
COVID-19, as you know, was a true challenge for everyone working in healthcare. And the people of the lab were in some ways the unsung heroes of the pandemic. If you go back to March of 2020, when this pandemic was first rolling towards us, we didn't have tests, we didn't have swabs, we didn't have a lot of the supplies that we needed, and the people who work in the lab were instrumental in doing everything they needed to do to find places that were giving tests, to find swabs, to make swabs, to figure out how we could prove what could we use differently, what could we use in a different way, so we could get everything we needed to really diagnose and treat people who had COVID-19.
We have a full service. We also have a lot of support people that help us along the way. We're not seen, but we're actually almost everywhere. When your doctor talks to you and says, we're going to send this to the laboratory, or we need to get this data, we need to find out something about this, and they draw blood or take a specimen, that's us. We're the ones who actually take that material and turn it into information that your doctor can use to make you better. It's a difficult thing to work hard to make patients better and not getting to see the results, but we encourage one another, and it is nice in some ways to be able to help without even knowing who you're helping.
The organizational culture is guided by FirstHealth's core purpose and core values: commitment to patient safety, quality, and performance excellence.
This is John Jackson. I'm the president at FirstHealth Richmond. I would like to recognize and thank the laboratory staff for the great job that they do in taking care of our patients and providing quality, accessible care. At Richmond, we have wonderful staff, great equipment, but we are in a 40-year-old space. I am so excited to announce that we are doing a $3.5 million renovation to our laboratory and make it a more efficient, up-to-date laboratory. Thank you again for the great service that you do.